Are you a parent with a child that's been diagnosed with attention deficit disorder? Or maybe your child's been described as lazy, not engaged, won't focus, or just simply falling asleep in class. Or maybe you are a little beyond your teenage years, you're in college, and you notice that you just can't get up to start those required classes at 8 o'clock. And you have to do something because graduation is looming and you can't seem to get out of the bed. I'm Dr. Hamilton Stubbs. I'm a double board certified sleep specialist and a certified nutrition specialist. Welcome to my YouTube channel. If you haven't subscribed, I hope you will. And don't forget to hit notifications so you'll know when I upload my next videos. In this video, I want to talk to you a little bit about narcolepsy. Narcolepsy is a neurologic condition that is also described as a sleep disorder. It affects about 1 in 2,000 people, and according to the nonprofit Sleep Project, about 200,000 Americans have narcolepsy. Narcolepsy is a condition that is often misunderstood because people aren't aware of it. Even doctors don't think of narcolepsy when you bring in your child with some school issues or falling asleep at home when they should be awake. I have even seen people who could fall asleep while standing. In fact, it's rare and often long periods of time go between being diagnosed. For example, a person could develop symptoms and not be diagnosed for 8 to 10 years. Here's some of the symptoms to look out for. People with narcolepsy have excessive daytime sleepiness. This means that they could feel alert and all of a sudden they just fall asleep. They tend to sleep at odd situations, like in the middle of a conversation. They can have something called cataplexy, which is where they lose muscle control suddenly, and sometimes they actually fall to the ground, and it's triggered by an emotion. Could be laughing or startling or surprise, and it's not always a complete fall. It could be like one of the patients I saw years ago. She came in for problems with daytime sleepiness, and what we found is that if she heard a good joke and she laughed very hard, she would get a predictable sensation that shot down her spine. But she thought that this was normal because everybody in her family had it. Well, she was describing cataplexy. And guess what? The people in her family that also had this funny sensation down their spine when they laughed at a funny joke, they also had narcolepsy. You can have problems where you wake up from sleep but you can't move. You know you're awake, but you're not really fully awake. And in some places, especially in the South, some of the Carolinas, it's been described as the witch riding you. So if you're having that, you may want to find out if you also have a problem called narcolepsy. You can have problems where you wake up and you can't move. This is called sleep paralysis. And this could happen with conditions other than narcolepsy. If you're severely sleep deprived, you have bad obstructive sleep apnea syndrome, not treated appropriately, you can also have problems with sleep paralysis. And here's something that is a symptom that you wouldn't expect from a person having problems with excessive daytime sleepiness. People with narcolepsy don't sleep well at night. They tend to wake up and have interrupted sleep. There's two types of narcolepsy. One type is with cataplexy, which is pathognomonic. This means there aren't any other conditions that we know of that's associated with cataplexy. And if you happen to have a cataplectic episode in front of a doctor or a healthcare professional who can rush and check for reflexes and they won't be there, this is enough to make a diagnosis of narcolepsy. But if you don't have cataplexy, then you have type 2 narcolepsy and you need other testing. So how is it diagnosed? It's diagnosed by going into a sleep lab where you're monitored at night and then during the day. And prior to going into the sleep lab, you have to make sure that the person isn't on any kind of medications that could suppress dream sleep. Remember, there are 4 stages of sleep in a clinical setting. Stage 1 is that light stage of sleep. Stage 2 is the first true stage of sleep. Then you have your deep sleep, stage 3, and REM. So we all talk about getting enough dream sleep, but with narcolepsy, there's no guarantee that you're going to get enough dream sleep at night, but you tend to get it through breakthroughs of sleep during the day. And when you are being diagnosed, what we're looking for is periods where you go into dream sleep or the patient goes into dream sleep much sooner than expected. Most people don't go into dream sleep, or I should say children of a certain age and adults don't go into dream sleep before 60 to 90 minutes. But people with narcolepsy can go into dream sleep within a few minutes of falling asleep. After a full night evaluation of the sleep structure, this is also going to help rule out things like obstructive sleep apnea syndrome or periodic limb movements, which are associated with restless legs and can give you some problems with daytime sleepiness. But after that nighttime study, a series of daytime naps are done. And during the naps, the person isn't allowed to sleep in between these 5 naps, and the technician is allowing you to sleep until you have a dream episode or REM sleep. And what we're looking for on these daytime naps is 2 episodes of dream sleep. Most people who don't have narcolepsy won't go into dream sleep on 2 of the 5 naps. Now, if you have your dream sleep in the first 2 naps, then the technician may not give you all 5 of the naps. Sometimes if you have just 1 nap with a rapid onset of REM sleep, the nighttime polysomnogram can be helpful, because if you went into REM sleep early during the night period, we could use that as well. So how are we going to evaluate you in addition to the sleep study? Your medical history. We need to make sure that the sleepiness isn't caused by another sleep disorder or medical condition. We also want to do an examination just to look and make sure that the neurologic system is intact, all your body systems are functioning well. And then I like to do a 2-week sleep diary before you go in for your diagnostic polysomnogram. This way I can get an idea if you're getting enough sleep, because inadequate sleep will make you appear to have narcolepsy on a sleep study when it's really not narcolepsy. And we don't want to misdiagnose people with narcolepsy when they don't, because narcolepsy can involve periods of treatment for long periods of your life. The symptoms do tend to get better with age, but they may not. And so we're looking at treatment with medications, lifestyle changes, and your diet therapy. Sometimes you have to go into counseling for especially children or teenagers who are not really willing to accept this diagnosis and some of the limitations that it may involve. If you want to learn more about narcolepsy, I have a list of resources on my website. If you haven't already subscribed to this channel, I hope you will. Don't forget to hit the thumbs up button, and if I said something that is helpful to you, give me a thumbs up and share it. I'm Dr. Hamilton Stubbs. Thanks for hanging out with me. My website address is drhamiltonstubbs.com, and I'll put it in the comments below.